It's a pleasure to have Professor Suraksha with us. She is a senior lecturer at the University. What she is going to present is the work that is almost a multi-country project that she is involved in, and how we look at MNCs and how they bring in some prosperity to the market that they are going to. That's essentially is the problem that she is going to talk to us. And try to develop some framework which possibly can be not only applied to one market but can be taken to different markets also. So,
thank you. Thank you, Piyush. Yeah, so this is actually a project which is named MNEmerge. This first slide is Professor Juha Vatanen from Lappeenranta University of Technology in Finland. He is the principal investigator for the project. So, first sector or first set of slides is which he was supposed to present. So, he cannot be here. So, I am presenting for him. So, basically the purpose of this project was to understand what kind of contribution are multinationals making to emerging markets in terms of social development. Are they really doing anything? Because they are obliged to add value in terms of development into the market wherein they sell. Now, when we started with the project, it was Millennium Development Goals, and slowly when we, while we were progressing on the project, it became Sustainable Development Goals. Now, when we started, we were looking at access to medicines, rural electrification and sanitation, and they are a part of Sustainable Development Goals even now, but while we progressed, we started looking at different variables, then we focused down, finally narrowed down on two important variables, that was how are multinationals contributing to the capability development of local firms in developing markets, and how are activities of multinationals contributing to poverty reduction in developing markets. Duration of the project was 3 years. It started in January 14 and it will end in December 16. Now, there were many countries which we were focusing on in terms of target markets. We were, 3 countries: Brazil for rural electrification, Ghana for access to food, malnutrition and capability enhancement, and India for sanitation and access to medicines. These are the partner institutes who were working together on this project. Lappeenranta University of Technology was the project principal investigator. University of Oxford was engaged more into the methodology identification. Public Health Foundation of India was responsible for the access to medicines part. University of Birmingham was engaged in the first field very strongly in terms of development of the conceptual framework and then refinement of the framework. University of Turku is the dissemination partner. CSIR Ghana was working on capability enhancement and malnutrition. I am from University of Kent. I was actually looking at the access to medicine and rural electrification parts in terms of contribution from the beginning, from the conceptual side to the reverse engineering side. When I say reverse engineering, I mean I was trying to look at how can companies benefit from social development, like, because I will discuss this in detail later. MNEmerge, United Nations University, was responsible for sanitation, and INSIC Brazil was focusing, they were getting a lot of input on rural electrification. So, the entire project was divided into different sections. Every university had different roles to play. So, certain things are here, like, but overall what we did in 3 countries was we looked at mainly poverty reduction and capability enhancement in terms of sustainable development, sanitation, access to medicine, energy, agriculture. So, we did cross sectional, cross cultural study, and we looked at how, what kind of policy implications can we make. These are the advisory board members, list of wherein we have Alkota, Buckley, Zinkota, Datta, Post, Reddy and Mishra. These were the members of the advisory board who were interacting with us quite frequently and who were looking at the whatever was happening from audit point of view and whatever was missing point of view. Then we did lot of dissemination activities just to gauge where we are and whether the track is right. Some pictures, we all are looking pretty happy with what we did. So, this is the list of slides which I think I should skip. Now, this is the first section wherein we developed the how did we start and how did we finally moved on. We looked at MNEs in developing countries, and then we started with the concept from the literature saying that MNEs are blamed for serving only the elite. They serve only the urban markets, they serve only the markets wherein there is lot of purchasing power in hands of consumers. Simultaneously, they also force local government to utilize the resources that the local government has into the areas of their interest, and they do not share with local knowledge with local firms. So, this is something which we extracted from the current literature. When we were doing all this, as I said previously, there was a transition of MDGs into SDGs, and now what we are saying SDGs 8 and 17 are the ones that we are focusing on. So, when we look, we were trying, so when we started the project, we first started with a literature review phase wherein we looked at the development studies, we looked at the international marketing literature, international business literature for linkage effects, and we looked at the management literature for spillover effects. This is the basic conceptual framework with which we started the project, based on which we got the funding. Then we used first after the literature review we used case studies. We looked at cases in 3 countries, Brazil, Ghana and India. We looked at various industries, as you see, food, pharmaceutical, power generation and ICT, list of companies in different countries, and then we looked at various sources and we conducted lot of interviews with different set of stakeholders wherein MNE managers were there, supply chain managers were there, NGOs were there, policy makers were there, managers in the head office were there. So, we tried to understand everyone's point of view and take a multidisciplinary approach to understand what we are doing and where is the research question going and where is the research heading to. Now, after we looked at the data and all the anecdotes, we said, well, we can say there has been some achievement in terms of poverty reduction, but then if you look at this slide carefully, this is a slide from one of the World Bank reports. This is mainly because of the China effect. China has done a very good job in terms of poverty reduction. If you take off the China effect, if you do not look at what China has done and if you look at the rest of the world, nothing has been done. So, basically it is the China effect that is based on which everyone is saying that there has been poverty reduction. In reality, there has been nothing outside of China. So, basically based on the review of literature, we had some findings, we had some conclusions wherein we say, yes, firms that are linked with multinationals, they do benefit. They do benefit in terms of skill development, in terms of capability enhancement. But MNE's presence in terms of wage levels of local individuals, yes, it does increase. People who work with multinationals, they get better salaries, to put it in simple terms. MNEs are willing to share generic knowledge, but they are not willing to share technical knowledge. MNEs are not particularly interested in sustainable development or poverty reduction. Their aim is just come into the developing market, sell very well and earn profits, and the unfortunate part is they are not even investing their profits back into the developing market, they are taking the profits back to their home country. So, basically what we learned from this part of the study was that local government has to play a very important role wherein they have to step in And for example, we had case studies from Brazil in terms of rural electrification. The Brazilian government has put in a regulation that every multinationals has to invest into the local market, they cannot take the profits back to the home country. So, there are policy recommendations for the local government wherein such recommendations are being made. So, the other thing is host country government provided incentives in terms of the incentives that host country government provides to multinationals, it attracts FDI, but in most cases MNE benefits from these incentives. What happens is, for example, if a country provides 10-year tax exemption to a multinationals, by the end of 9th year multinational starts saying, well, if you do not extend my tax exemption, I will move on to another country. So, that kind of exploitation is happening on terms of MNEs. MNEs can play in role in capability enhancement, but they are not doing, because they are actually trying to hold on to the innovation into the home country. They are making sure that the innovation does not, innovation capability does not pass on to the host country. Now, if you look at all this, it is very clear, particularly when we looked at the access to medicines market. What is happening is, previously, for example, Indian market, there were many pharmaceutical companies which were very good in innovation. Now, in last few years, multinational companies have been coming into India, and they have been acquiring all these companies which have been good on innovation, and they are converting all these Indian companies into contract manufacturing companies. So, most of the pharma sector in India today is engaged in contract manufacturing. They are neither interested in innovation, and they are just very happy earning profits from contract manufacturing. So, there is no capability building that is happening on the Indian side, that is where the problem is. So, if you look at this situation, the fear that we have is that all the multinationals are getting very strong, they are getting very strong hold of every market across the world, and the entire market, world market is moving towards very, very monopolistic situation. So, the other advantage that they take is the kind of environmental issues that they have with their production, they use emerging markets as grounds for producing such products. So, we revised the entire framework based on all these findings from the case studies and the literature, and this is the updated framework which now needs to be studied by the next project. This is the methodology section which I am not, which was not my part, but I can explain a little if someone is interested, but I think for now I will skip this. So, just for your information, we looked at Ghana for in terms of growth and industrialization and capability enhancement of local firms, and we looked at the food sector in Ghana. And if you see here, there has been no significant industry change in 50 years despite all the multinationals going into Ghana, and implementation of national policies for MNE operations need a radical change, because it is very stagnant there, nothing is happening because the government is not active. So, sorry. So, we looked at employee level data, we looked at managerial data, we took 60 interviews of 61 managers and 173 workers, wherein different MNEs, and firm level data 500 firms in Ghana in 23 and between 23 and 2015. Now, here there are some interesting findings from this phase from the Ghana study, that is actually capability enhancement is happening more because of the European firm and less from the Chinese firms. So, that what I am saying here is that if I am an employee in a company, if I am working for a European company, I will learn more. If I am working from for a Chinese company, the learning will be very little, but the element of hard work in a Chinese company will be very much. That is the outcome that every employee has to give is very highly monitored in a Chinese firm in comparison to European firms. The third finding that this section had, this part of the project had, was European firms are very, very gender sensitive. Chinese firms are not. So, there are lessons to be learned for the African government if they want to use it. This group has come up with policy implications for the European firms that they have to invest more on the skill development and welfare of the employees, etc. And local government in Ghana has to facilitate local outsourcing partnership, because if you look at examples of companies like McDonald's, wherein the fries are also coming from one source across the globe. So, then this kind of concept will not lead to development in Ghana. So, the civic concept has to be brought in, wherein the local businesses have to be encouraged and local partnerships have to be encouraged. So, institutional functions, etc., we are talking about in this section, but I think we will. Now, the next phase was about access to medicines. This was conducted by Public Health Foundation of India. If you see here, basically in this slide they are trying to say that average money that an Indian spends on health, taking care of health, is very high. So, average spend of every Indian on health care for the entire family becomes multifolds. And when you look at the medicine market, the domestic market, the size of the domestic market versus the MNE market is very high, but when you see here wherein the innovation is involved, sorry, this is, yeah. Now, if you see here vaccines, hormones, so till here, particularly these three pillars, these are the ones which need innovation, and the control of multinationals is very high here, and there is very less engagement of the local firms. Whereas here pains, see basic analgesics and neuromedicines and etc., they are very well advanced today, and the local engagement is very high in this section, which proves the point that the local companies are engaged in contract manufacturing, which supports the argument, and they have very little to do with the innovation part. So, PHFI looked at the foreign direct investment policy and Indian Patent Act, and they did certain interviews here. Now, in this slide, the most important finding is from the FDI policy, 1 out of 67 FDI investment was greenfield, whereas every MNE claims that their investments are greenfield and their investments are actually brownfield. They looked at Indian Patent Act, and now policy implications, they are trying to say that prioritize greenfield FDI. So, local government has to play an important role in regulating and in ensuring that all the FDI that MNEs claim to be greenfield are actually greenfield. Today, they are just trying to invest into areas which have infrastructure, which can give them market, which can give them sales. They are not trying to move out of the markets which are fully developed. Now, looking at all that, one major lesson we learned was managers or multinationals are not interested in social development. They are interested in profits. So, as academics, it becomes our responsibility to give them certain models which will make them interested in social development, because that is one of the corporate targets that a multinational has. The managers who work in the target market, they are the mid-level managers, purchase manager, sale manager, national manager, country manager. They are not the top managers, but this kind of policy should percolate from the head office. And how can we make these mid-level managers interested in social development in the target market? So, basically I took the case of access to medicines, because that was if we could not mix all the four, because every case had or every phase or every dimension of our study had different context. So, we stuck to access to medicines. Now, we first went back to the greenfield versus brownfield. So, again we looked at lot of anecdotes in this case. because we had done the literature review, we said, okay, let us go through the anecdotes. 92.52 is brownfield and only 1.48% is greenfield, which is very, very scary. Then we looked, what we did was we picked up all the annual reports of multinational companies and we said, okay, let us see what kind of activities do they claim, do they use to claim that they have been doing social development. So, they these are the 1, 2, 3, 4, 5. So, first the most important, the most favorite program of managers is use patient access program, then create some infrastructure, work on environment, create education and awareness and provide financial assistance. Now, in patient access programs, they use prevention and detection program wherein they try to create marketing campaigns which are directed towards prevention and detection. They try to work with health centers and clinics and they try to work with rehabilitation units. In terms of infrastructure, they try to work with these medical centers and other medical hospitals to develop environmental friendly structures. They will say, then they will have a board wherein this place is sponsored by, etc., those kind of activities, and development of least developed areas. In terms of environment, they are focusing on waste management and water conservation. Education awareness, well, they are working with vocational training centers, primary education centers and community colleges to create education and to provide education and create awareness. And financial assistance, they are working with the government and they are providing certain aids. Now, the problem here in this is patient access program is they are using this for their clinical trials. That is one major thing. They are doing it for their R&D and they are doing it for their innovation. So, we had such problems which we came across. Then we tried, we said, okay, let us create a simple table so that we can understand what is happening. We are talking about a lot of things here. So, if you see here, the interesting part is patient access program, so many companies are involved, and education and awareness, so many countries are involved. Now, patient access programs and education and awareness, if you think of it carefully and if you look into their reports carefully, these are the two routes for marketing and sales. They are using only these two and very little is being done in terms of financial assistance, almost negligible, only Pfizer is doing it. And in terms of infrastructure, Sanofi, GSK and Janssen is doing it. No one else is contributing to the infrastructure. Environment is also not very great, if you see here. So, basic two areas are patient access and education and awareness. Education and awareness helps them create more brand awareness and patient access program gives access to the sales channels. So, based on all this we said, okay, now how do we encourage managers? That was the basic point where we started. So, literature says that MNEs are using acquisition to have a control of the market, branding to promote their product in the market and using distribution channel for market penetration in terms of generating sales revenue, channels and sales revenue. Sorry, I do not think you can read this. So, issues for MNEs here, if you, I will just read it out. Business dynamics is the biggest problem that MNEs have, because we were looking at all these issues from managers' point of view. So, business dynamics is the big of countries which are developed or which are not developed. That is one of the major issues, because they do not understand the culture. Even if they hire local managers, they are not able, local managers are not able to synchronize the policies of multinationals with the local culture. And state of governance is another big issue that MNEs have in dealing with developing markets. So, how do we go ahead? Now, we be looking at the governance and the dynamics issue and the kind of activities that multinationals are engaged in today, what should be done so that managers at the local level in the regional markets of global companies are able to contribute to social development. We made three types of recommendations. One, because we know, we all of the multinationals, as we understand, you have very strongly used branding theories to promote their product and sell it. So, in terms of branding, they have to focus on building a corporate brand, and they have to incorporate the social agenda into the mission and vision of their corporate brand. So, if it is included in the mission and vision of their corporate brand, then the entire message will percolate down the supply chain, down the operational chain, and the managers' efforts will be focused on the social development. There will be little bit of focus that the movement that will happen, and integrate poverty reduction into into the corporate agenda. Now, in terms of acquisition, when they are acquiring a local company, they have to engage the local partner into the innovation, that is into the R&D programs, and engage them in terms of innovative practices also, so that there is some learning on the part of the local firm also. Distribution. Now, engage distribution network into social development. Engaging distribution network into social development will help the multinational to make sure that their social development agenda is achieved at every level of the supply chain, and include capability enhancement into industrial practices, wherein if they have a retailer training program, they might include some kind of a CSR project which will be told to the retailers, which retailers can pass on the information and can help the company to achieve their objective. So, these are the certain things. We have not been able to collect any data on the branding part for the managers. This is just a conceptual and the literature and the case findings. Now, we have been able to disseminate some of our findings in some of the very good places. For example, we went to UNIDO, and we had more than 2 hours discussion with the partners there, wherein they said how can we take this project further. Recently we did it at EBA, last year also we did it at EBA. So, many areas have been there. So, strategy of dissemination was to present it to local stakeholders and explain the findings to local stakeholders, so that we could get some more inputs to push the project further and push the finding further. And policy recommendations have been presented to EU and UNIDO, and final results at EBA 2016 have been done. Some of the pictures again. In terms of publications, we have come up with certain publications, and again various avenues wherever possible. So, this is what we have done in MNEmerge. On 31st December, the project will get over. Hopefully, we will be able to come up with some more publications. Thank you.
Thank you. I was just thinking about 2 or 3 points which was coming up, which is, one is what you rightly pointed out, that these MNEs are looking these as markets. These countries are markets.
Yeah.
That's something which is there. And also they identify a market where there is already demand existing. So it's more of a demand fulfillment function than demand creation function that is happening.
Exactly.
That's something which is there. And in the area that most people will get in, there is also a kind of a perceptual hierarchy between, especially if you look at medicine, for example, there's an MNC brand, there's a local brand, and then there's generic. So some kind of hierarchy also has been created over time, right? Which also favors these companies to do it. What I like about the finding which is coming out is that, or it is also emanating from the fact that the local managers do not have any authority to do anything but to sell. That's something which is, even if they have set up a factory here, like maybe they would set up a factory or do job contracting, which is in a way they will contribute to it, but they don't have power to do anything than what has been doing. Interestingly, I mean, some of the experiences that we have been having here, 2 industries which have been affected because of the multinationalization is advertising research.
Okay. Oh, very interesting.
Now, it's all about data collection and implementation, nothing else. All intellectual development happened back there in the corporate office. I'm witness to it because if you just go back about 5 years ago, local companies, local research and advisory agency will come up with different models which are more set for this kind of enterprise. But now, either you are part of some of the conglomerates, which will become part of some of the conglomerates, and you can witness consolidation also in this regard. So, result is that intellectual work has moved to the corporates, right? Now, which is where unless it is in the area that they have no expertise. So, for example, rural marketing one, they have no expertise. So, they need to find out some way of doing what it is, including business models that need to be developed. That's something which that's part of this market. The other sector which is actually forcing them to localize is services. For example, if you look at the QSRs, quick service restaurant like McDonald's and they really have to change the business model. What was designed there did not work here. So they really had to change the whole thing. They had to start sourcing locally. They had to train people to do it. So a lot of investment went in. Now, which is where the question that you brought up very, very interesting. That because therefore that's the reason why they are not making money. Right. Similarly, recently, Government of India actually opened the retail sector with 100% FDI.
Yes.
But they will have to keep only goods manufactured in India, in the same country, right? The idea was that you will set up factories here, you will source locally and all that. But we haven't seen excitement happening there.
Yeah, we haven't seen much.
Despite the government initiative coming in, right? They're saying you are allowed to do that, you can set up a factory. So you may be an MNC brand, but don't source from China. Please get it manufactured here and then we'll do it, right? But the response has been very, very little. That's one. Similarly, retail industry per se, the response is not something which is there. Even if there is demand.
Yeah.
Even if there is demand.
I think now here two things. First part, when you said managers, yes, we spoke to many managers and they are very clear that we don't have time for social development, we have to sell, so we have targets. So that story is clear. As regards retail, and there is lack of excitement on the initiatives that government took few years back, opening the retail. Multinational, and now I am saying from MNE point of view, they fear coming to India. If you look at the production market, production sector in China and production sector in India, if you compare the two, you see the drastic changes. Anyone can see the drastic differences between the two. China is a very disciplined market. India is not a disciplined market. We enjoy democracy. So because of democracy, there are disadvantages that we have. Because of those disadvantages, MNEs hesitate to come and produce in India. So because of that hesitation, despite having a market here, they don't want to move their manufacturing to India, which now India is trying to build on. But I think we have an opportunity there. If we can break it, then there is very good. But then again, there are challenges in getting manufacturing into India, like China is facing today about pollution.
But just another point this is, now if you compare, let's say compare the 4 BRIC countries and the African countries, right? Does your study also bring out something which says that there is a capability issue also in the local markets and people that we have, which will require huge amount of investment in capacity building by an outsider to come and do that?
We haven't looked at that. We just looked at the contribution of multinationals toward capability enhancement. We didn't look at the local market and the capability available in the local market, because then we'd had to change our lens. So our perspective would change if we look at that. So we didn't look at that. But yes, I think as main important element that came out of this was the role of the local government. Local government can actually do a lot in making sure that these MNEs selling here are engaged in social development. One which I think I mentioned also, lesson that we learned from Brazil, that MNEs should not be allowed to repatriate the profits back to the home country. They should be encouraged to invest the profits back into the host market. If they have earned profit from here, they should invest it back into this country to increase their profit. If they want to take it back, there should be a certain percentage.
You also look at the whole thing on the whole intention to globalize. You know, if I'm a company and I'm trying to become a global company, I don't mind whatever I do in other countries as long as I can show that I am globally present in so many countries. I become a global corporation, which is where my NASDAQ or NYSE perform better, and therefore it's
No, we didn't look at that side.
that's another,
That would be a different.
that would be
yeah.
a different study. I know, I understand that, but you know what I'm finding is that a lot of globalization happens because you want to show a footprint, which shows that you have potential to grow, which is what helps you increase your EPS at this. That's another.
Which is your share value ultimately. And yeah. So instead of stakeholder, shareholders gain.
But I think that's what I think is a point that is being made, and which is what we are also looking at. That especially in the areas which is good for the country, like health use and one thing,
Yeah.
or basic necessities like sanitation and things, government has to come up with a very, very strong mandate.
Exactly. It is the government, because you see multinationals are doing what their agenda is, public is doing what their agenda is, local firms are working hard to survive in the market. But where the problem is, it is the government. Government has to play an active role in regulating all this and controlling all the activities of multinationals in developing markets. Today, it is the government which is giving leverage to multinationals, and they are in such a fear that multinational will leave the market, the country, and go out. So they tend to give in to the tantrums of multinationals, which I think they have to avoid.
You also see in this way that actually one of the things that we see in the less developed countries is also finding a good local partner, where I can actually come and work at a strategic level. That's something which the local partner will also be as much involved as it is. Which is where, do you think that the government can actually become a local partner from that perspective, in the sense, just for example, if government builds the infrastructure, they are asking you to build the infrastructure, right? Partners, not saying that it is something which is there. I'm not talking of PPP model,
Yeah, I agree.
The PPP model has not worked, at least in this matter, as much as it should have. As much as it should have.
Okay, the scope has not been achieved.
It has not been achieved the way it should have. In some sector it has happened, some sector it has not happened at all. Which means that it's not about MNC or a local company. It's the context we have, and therefore the role of government becomes that much more proactive in making things happen. In the sense that can government therefore come as one of the investors in the stakeholders, not just regulator, as also a stakeholder.
Definitely, I think that will have a very important effect, very good effect, positive effect.
That's something which is so that I as an outsider have confidence that I'm not dependent on one person, but it's the state government or the federal government is what is.
See, that is what is happening in China. That's why the development in China is so strong. Government is actually a partner. They invest.
So which means that it's not just regulation, and along with that regulation will come in any case, but it's not the regulation, but can actually show that I'm equally interested, I'm just not inviting you to do this. That's something which is there. But something that we might like to bring in is that some examples on how MNEs actually brought new ways of doing business into this. That might I'm just flagging it. I'm not.
Sure, there is some knowledge transfer, but the capability enhancement is not there. Knowledge transfer is also very limited. If you remember in the Ghana slide, Ghana study, knowledge transfer is there, but capability enhancement is not there. Companies transfer knowledge only that is required to a certain extent, whatever is required to operate, and they put a full stop there. They don't go beyond. So,
Thank you. Thank you very much.